Hello and welcome back to All About Community. Again, my name is Robert L. Harris and I am your host. In this segment, we're going to talk with Dr. Jocelyn Freeman Garrett, a well-known physician right here in the Bay Area. Dr. Garrett is a emergency room physician as a general rule, but now she's in a new role. Dr. Garrett, welcome to the show.
Thank you, esteemed Bob Harris. I appreciate you inviting me to be here today.
Esteemed, come on. Let's talk just for a moment about your background. Did you grow up here in the Bay Area?
I did. I'm from San Francisco. My family's from the Hunters Point Bayview District. I went to school in San Francisco, elementary and high school, and then matriculated to UC Berkeley, came all the way across the Bay to go to Cal, go Bears, and then went on to medical school in Southern California.
And I think when you were at UC Berkeley, was it that when you met my daughter, Regina?
I met your daughter, Regina. We had the opportunity to pledge our beloved sorority, Delta Sigma Theta, together.
Delta Sigma Theta, just to be a Delta girl. See, I know all that didn't happen.
Yes, but your beloved wife is a member of Alpha Kappa Alpha, so we don't want her to get upset.
No, that's okay. She's always upset, but she's lovely.
We
she
love her.
Turns around very quickly.
Yes. So yes, we have a relationship through your daughter. Yeah, for over 30 years. Mm-hmm.
Absolutely.
Mm-hmm.
And you also, I believe, received a master's or something?
I did. After medical school and completed my residency in emergency medicine in New York, I then did a master's of science in epidemiology and biostatistics. I thought that I wanted to research victims of violent crimes and understand health disparities as it relates to violence. So I did that while working part-time as an emergency physician at Kings County Hospital. When I finished training at Jacoby Medical Center in the Boogie Down Bronx, I then did the fellowship at Cornell.
So you can see Dr. Garrett is awesome, well prepared. I just wanted to get that background out just in case you didn't know how well prepared and awesome this young physician is. What made you want to go to medical school in the first place?
My parents tell me that I always said I wanted to be a physician. I think that I just landed into it. I wore glasses since I was 7. I thought I wanted to be an ophthalmologist. I actually didn't even know the difference between optometry and ophthalmology. When I went to Berkeley, I thought I could matriculate to their school of optometry and then quickly realized they didn't do surgery. They didn't get to go to the operating room. The optometry is a great field. It just wasn't what I thought. So they then advised me I needed to be on a pre-med pathway. And then I volunteered at Highland Hospital over 30 years ago as a junior. And when I volunteered at Highland, I was enamored with emergency medicine. So I got to see medicine in the acute setting for a variety of people.
And I understand that the emergency room is where you see just about everything, the knives, the gun wounds. I mean, if you really, really want to know what the practice of medicine is all about, go to an emergency room where you see everything.
You do see everything. I think that most people assume that it's associated with violence, interpersonal violence. It's probably about 10% of what we see. The rest is bread and butter medicine. So we do get to see the breadth of medicine, which I do love. And it fits my personality of multitasking, constantly moving, constantly challenging yourself. Always seeing something maybe that you've never seen before. So you're always learning. I feel like I never plateau in emergency medicine because I'm not a specialist in oncology. I'm not a specialist in gastroenterology, but I get to dab into it and at least treat it in an acute setting.
And you get to see all kinds of stuff like viruses that may come into the emergency room. And now we have a new pandemic that has invaded this nation and the world, coronavirus. Can we talk for a few minutes on coronavirus? How has that impacted your practice and the Black community?
So as an emergency physician, I also hold the role of disaster medical director for our system. I was intimately involved with our response. It has changed for the medical center. Initially, when we didn't have enough testing supplies, you may recall in March and April, they were encouraging our citizens to stay home. The emergency departments across the country and at my facility, volume went down. When we saw someone, it was when they were really ill because they may have
So you had
waited.
to just wait until they got really ill, and then that's a little dangerous, isn't it?
Yes. We found that people were coming in when their asthma or their chest pain was in extremis, when their diabetes was in extremis. So we had to message to them, don't stay away from the hospital. Please come in, despite the fear of this unknown coronavirus. In June and July, our incidences started going up. So early on, we found a way to treat COVID safely, to isolate those patients safely, to test them safely. We had more access from our government to protective equipment as well as tests. So all of the facilities have adjusted to receiving it in a safe way. But now people are out in the community more. For African Americans, it's pivotal that we Blacks wear masks. That the Black population can isolate and quarantine if they're able to. In Alameda County, I will share, Bob, that about 8% of anyone who gets COVID in our county is Black, and we represent about
8%.
8%.
Let's pause on that for a few minutes. We need to go to break. Don't touch that remote. Put it down. We will be right back with All About Community, talking with Dr. Jocelyn Freeman Garrett.
Sinclair Miller Medical Association, founded in 1968 by Dr. William Sinclair and Dr. Rudolph Miller. The organization was formed to improve the health care of African American and other minority people in the Bay Area. Sinclair Miller Medical Association offers annual scholarships to high school, nursing, and medical students who are African American. Presently, Sinclair Miller Medical Association has over 160 members. Sinclair Miller maintains its commitment towards the betterment of the field of health, education, and welfare. For more information about Sinclair Miller and scholarships, contact Sinclair Miller today at 510-863-4560 or visit our website at www.sinclairmiller.org.
Hello and welcome back to All About Community. When we went to break, we were talking with Dr. Jocelyn Freeman Garrett, outstanding young physician here in the Bay Area, working at Highland Hospital, Alameda County Health Systems. I think I got most of that correct. But we were talking about testing and the impact of coronavirus, COVID-19, I believe they call it, on the African American community. Tell us about the death rate and other aspects of that.
Yes, the concern in our county is about 8% of anyone who gets COVID in Alameda County is Black.
8%.
8%. And about 8 to 10% of anyone who gets tested for it is Black. The concern, the difference in outcomes is of those 8%, for those who get hospitalized, it's about double. For anyone who has COVID and gets hospitalized, about 18 to 20% are Black.
18 to, okay, from
And then,
8% to 18 to 20%.
Right.
Hospitalization, Black.
And of all of those who die in Alameda County, who have died, we've had about 200 deaths in our county. 23% of those are.
So it keeps going up.
Yes. So we are more likely to be hospitalized and die. We were able to do some sub-analysis on that. And early on, you may recall that we were having outbreaks in skilled nursing facilities and those nursing homes. It was the same here. We recently have been able to get data from the state and our county that shows we had a significant number of Blacks die who were in skilled nursing facilities. About 3 weeks to a month ago, we had 40 Blacks who had died in our county. 19 of those were in skilled nursing facilities.
What is the cause of that high death rate among Blacks who are hospitalized for this virus?
It's multifactorial.
Okay.
You know, the number of individuals, almost half of the Blacks who died in our county were in skilled nursing facilities.
Okay.
So they're older, they already have comorbid illnesses that require them to be in a nursing facility. So that contributed to it. It could also be that just systemic injustices that happen with the medical system. There are unconscious biases that may impact it in the health system. There's mistrust that our Blacks have, and we may wait to go to the hospital later, and then it's harder to recover.
Well, when should we go? Tell us, give us some indication as to how the disease may come on, and when should we go to the hospital or seek medical advice? Probably
it's a challenging question, Bob, because we're learning so much about the virus. Initially, they said cough, fever,
Right.
shortness of breath.
Yes.
Now they're finding that it's diarrheal illness or just lethargy. You just feel weak. You just have this general feeling of no energy. It can present in any way. And I would say with that, especially if you are over the age of 60, if you have diabetes, hypertension, you're immune suppressed for any reason, and you just don't feel well, you need to go to the hospital or your doctor and get checked out. 80% of the people who have died in our county have been over the age of 60.
80%.
60% are over the age of 70. So the older you are, the more likely you are to be hospitalized and die. So, but most of the people who have COVID in our county, more than 2/3, are under the age of 50. So the younger people, we theorize, who are working, essential workers who aren't able to work from home, who may live with their grandparents or their parents or an aunt. They can be asymptomatic carriers, have no symptoms, but are able to transmit it to an older family member who does have comorbid problems. And they end up maybe waiting too long. I'm just not feeling well, baby. I'm just not feeling myself, not realizing that they have the illness. And then they go to the hospital with complications, and it's harder to recover.
The president said that children are essentially immune from the disease. Is that correct?
That is not correct. And I just want to tell the audience that children are less likely to contract the disease, especially the younger they are, but they can. They allowed preschools to open probably across the nation because data shows that children are less likely to get it, but older children can potentially get it. What the data is showing that children can have it and be infectious, but have no symptoms. Children are less likely, like younger adults, to have symptoms. They think it is less likely for children to transmit it to an adult, but it's a new novel coronavirus. We're still learning.
I see where the University of North Carolina opened up last week, I guess, for students. And now this week it had to close down because of the virus.
Yes.
So somehow somebody is misperceiving what's going on.
Our county, Alameda County, was placed on the state monitoring list on July 12th because our cases were going up in June and early July, as well as our hospitalizations. That prevents us from opening schools at this juncture. Outside of our country, in many countries in the world, schools are open, economy is open, but schools are able to open when community transmission is low, when there's adequate contact tracing, and there's adequate mass testing. We don't
Well,
have
on that
yet.
note of testing, we're going to have to take a break.
Okay.
But when we come back, I want for you to update us on where testing may be and how people can get it. We have to go to break, so don't touch that remote. We will be right back talking with Dr. Jocelyn Freeman, Elder Freeman Garrick, about to promote you to a famous position.
I
But that's
heard
okay,
that.
but you are famous. We'll be right back with All About Community.
Hi, we're Minuteman Press Oakland in downtown Oakland at 2406 Webster. We're your local printer. We help your business grow. We provide flyers, business cards, direct mail, any product that you need to promote your business, we have it. And remember, at Minuteman Press, no job is too small and no job is too big. Come by, stop at our shop at 24th and Webster, right behind the YMCA in downtown Oakland.
Hello and welcome back to All About Community. Again, my name is Robert L. Harris and I am your host. When we went to break, I was speaking with Dr. Jocelyn Freeman Garrick, not Elder. I need to say something about that. Elder was one of the pioneer women in the National Medical Association. I believe she was the first the first female president of the National Medical Association. Hopefully that clears that up. Dr. Garrick, inform us, if you will, on testing and where can we get tested?
Well, thankfully, in Alameda County right now, for our local listeners, we have dozens of locations. If you're insured, you can go to your private insurer. If you're a vet, you can go to the VA. There are several clinics that offer testing. But Alameda County is promoting now 11 community testing locations.
11?
11.
And where can you find those 11?
I just left the grand opening of Asian Health Center has one at Madison Square Park that offers 14 languages in a culturally relatable way. West Oakland Health Center, started by the Black Panther Party, right in the heart of West Oakland, is offering testing. We have multiple locations in East Oakland and the Fruitvale.
Is there a website or anything that...
There is. The listeners can go to Alameda County Public Health Department, just Google it, acphd.org. And if they do that and click on where can I get tested, they can see the 11 community testing sites. Many you can walk up without an appointment. You do not need insurance. They are all free testing sites, and we encourage, especially those who are essential workers who cannot work from home, healthcare workers, skilled nursing facility workers, your teenager who has to work it in and out and is interacting with the public regularly, that those individuals get tested. If you are older with comorbid illness and you have a family member who has to go in and out as an essential worker, we encourage those individuals to get tested. But anyone in our county can get tested.
That's important. Anyone.
Yes.
No matter who you are.
No matter who you are.
Great. Any idea as to when there is likely to be a vaccine for this dreaded disease?
I'm hoping that early next year. That's what the scientists and Dr. Fauci keeps telling us. The good thing is we have dealt with the flu for over 100 years, and our county has been a leader to ensure vulnerable communities and at-risk communities have access to a free flu vaccine. They've done Shoe the Flu, the Alameda County Public Health Department, for years, and they plan on using the flu this year as a dress rehearsal for the COVID vaccine. They secured additional flu funding that'll help them vaccinate more at-risk individuals. In addition, they have 26,000 units that they can distribute to community members who are at risk and may not be insured or underinsured. And they'll be promoting that all children and adults who need it get vaccinated. That'll help hopefully prevent a twindemic. It will be challenging to deal with a flu epidemic as well as COVID. So there will soon be a lot of information. You can go to that same website that I mentioned, acphd.org, to get information about getting access to the vaccine, because private providers can request the vaccine. And if we can get all those who need to be vaccinated for the flu, it will help us not have two epidemics that we're dealing with, and see how effectively we can distribute this vaccine to help us prepare for the COVID vaccine that we'll likely have to distribute hopefully late this coming winter.
All right, that's great. I went last week and got my flu shot.
Mhm.
I mean, it didn't even hurt. I was just saying, oh, no, it's going to hurt. But it did not even hurt. I thought, well, when are you going to shoot me? Because I already shot you. So
now that's important because people fear.
yeah, I mean, I don't even think about it. It is just not a problem.
Mm-hmm.
Let's talk for a moment about some of your other things that you do. You have a mentoring program, I believe, that you're involved in.
I did. I founded Mentoring in Medicine and Science. We have a wonderful director. It's a nonprofit that tries to diversify the health workforce. It exposes youth and young adults to health careers through leadership development, career exposure, and mentorship. So we've served over 3,000 students.
3,000 from where? Where are those students from?
Most
All
of them
over?
are from the Bay Area, but now all over through several programming that has been impacted clearly by COVID as well.
Mm-hmm.
So like many other similar programs that we partner with, we're doing that through mentoring online and webcasts and networking online. But yes, thank you for mentioning that.
And how does it work? Do people have to put in an application or what?
They can go to the website, www.mimscience.org. But that website shows you how to apply to get a mentor or to participate in one of our programs.
So it's all on the website, and the person, again, if they're interested, will go to
www.amazonmaryimscience.org.
No, you remember a whole lot of stuff there. But I also understand that you are actively involved in another organization, not just Delta Sigma Theta, but another organization called the Links Incorporated, Alameda County, Contra Costa chapter, president of the Links. We're going to talk about that in just a moment when we return with All About Community. Again, my name is Robert L. Harris, and I am your host. Don't touch that remote. Don't even think about it. Put it down. We'll be right back.
Positive Links Day program is a community center that provides disability awareness to remove some of the stigmas associated with the disabled population. We are located at 675 Hagenberger Road, Suite 255 in Oakland, California. Our mission is to be a voice for those that don't have a voice. We are recruiting community volunteers for training to assist us to develop and provide awareness for the treatment available for the disabled community. If you would like to volunteer, you can reach us at 510-878-9779.
Hello and welcome back to All About Community. Again, my name is Robert L. Harris. When we went to break, I was talking with Jocelyn, I shouldn't say Jocelyn, I should say Dr. Jocelyn Freeman Garrick, and we were talking about her position as the president of the Alameda Contra Costa County chapter of Links. I think I got all that correct because my wife would kill me if I didn't. She's former president, former national president of the Links. Tell us a little bit about what does the Links, what do they do?
The Links is a national organization of professional women that is committed to service and sisterhood. So they have several pillars and areas that they focus on to improve the lives of people of the African diaspora across our country. So they use the network of professional women to come together, to collaborate, and to not work in silos, but to address with the collective brain trust, to address disparities that happen in the Black community.
And you all have a lot of, I shouldn't say a lot, but a number of projects that you're involved in locally, is that correct?
We do. Now with COVID-19, that has impacted, and Black Lives Matter, for an example. There's always been a health interest within the Links Incorporated. Now the national president has a team that's focused on COVID-19. Now we've always had a focus on Black Lives Matter. That has been paramount with the recent events. So we are getting a lot of new intel and information to disseminate to our communities and for the members to be empowered and informed so they can help educate and advocate appropriately.
And historically, you've done programs such as the Respect
Respect
Yourself.
Yourself.
That's been going on, I believe, about 15, 20 years or so.
More than that, yes. And that is a program that is done annually in the winter to serve middle school youth that expose them to a college campus, as well as different careers and opportunities to trigger their minds.
And I'm saying you do work with a number of other groups, including Kappa Alpha Psi fraternity,
We do.
in doing that. And that's so commendable. How do you find time to do all this stuff?
I think I'm like most emergency physicians. Most of us are ADD, constantly moving, multitaskers. My mom said I haven't been able to sit down since I was 2. I've always been involved in student government, leadership, dancing, moving.
Energetic, in other words.
And it's come
Any
from
final
family.
thoughts you have on COVID?
It's imperative for the listeners to protect themselves, to be informed, to read the literature and know what kind of tests they're getting. We have different tests that are out there and they can get more information on the website. They need to understand, are they getting a PCR test to test for acute infection versus an antigen test or an antibody test, which are different. So please just try to get as much information as you can and stay informed and protect yourself with a mask at all times. Wearing a mask really helps prevent the spread of the infection up to 90%. If we can just do that, it will really help us get back open and get to the economy thriving like we need.
What a great way to end. Wear your mask. Respect social distances. And those are just a couple of things that we can do. It has been a pleasure, Dr. Garrett, having you on All About Community, and we want you to return because there are so many things that I'd like to talk with you about, but unfortunately, don't have time. No matter what you do, when you do it, or how you do it, in the final analysis, it is still going to be all about community. Thank you for joining us. My name is Robert L. Harris, and I am your host.